I was working at the Gladstone police station at the time, and I felt a little bit dizzy. I stopped where I was, and then my vision just went completely down my right side. I couldn't see anything. Then I started to get a bit panicky. I thought I was going to maybe pass out or something. I thought, I've got to get out of here. I found my way to the door, walked out, told the people there what was going on, and they called an ambulance. So once we got to the hospital, first thing was they gave me a CAT scan. The doctor came in and told me, look, the CAT scan shows a spot on the back of your brain, and you've had a stroke, which just shocked me. I had 6 weeks off work initially. I guess the confusing thing was I didn't have any of the risk factors associated with stroke. So, you know, I'm not a smoker, I'm not a heavy drinker. From my point of view, I wanted to know what had caused it so you can sort of look for a solution. I had an ultrasound of my heart, and the lady doing the ultrasound said, oh, you do have a PFO. And she said sometimes that can actually cause some issues.
PFO stands for patent foramen ovale. Now in medicine, patent means it's open. Essentially it's a flap. So in the fetus, the flap is open. Most of the time when the fetus comes out, the flap closes. But a PFO is actually quite common. Up to a quarter of the population would have it. And when you have a flap that opens, you allow blood, minerals, you allow chemical to go through from the right to the left, and that may go to the brain. Now if you have a clot that traverses through it, it does lead to catastrophic complications such as a stroke.
It was worrying. I've got 3 kids. I'm sure it was hard on all of them, and my wife was beside herself too. It was quite a while down the track before I saw the cardiologist. I was unable to perform my duties as a frontline officer, and then my hobbies like diving, surfing, they're all fairly active. Made me a little bit reluctant to push myself physically. Really was just sitting in limbo waiting for, you know, something to happen. The cardiologist, he said, look, I believe we've got a solution, and he referred me to Dr. Carl Poon.
I think over the past couple of years, more and more neurologists are in favour, if not strongly in favour, of PFO closure. The procedure is generally done through the groin, through the vein. There's a device with 2 sides of an umbrella. Open up one parachute, close it, and then open up the other side to close it.
It was just a day in hospital. The actual procedure takes about 20 minutes, I believe. It's very, you know, quick and pretty basic. A week after that, I was back to full duties as a general duties officer, you know, frontline officer. So
in the past, young patients like Alistair, who obviously will be active, travelling, diving, helping the community, he would be at risk of bleeding just because he had to take blood thinners before his PFO was closed. Your risk of the procedure compared to your risk of not having it closed and putting yourself at unnecessary risk for further stroke, it's a no-brainer.
It just doesn't suit me to sit behind a desk and tap away on a computer and that sort of thing, and I'm the world's slowest typer, so I just couldn't wait to get back out and do my job, the job that I signed up to do.